All right, welcome back as we're still with CEO of Terrebonne General Medical Center, Miss Phyllis Peoples. There you see her. She's had, we thought she was busy before, but I don't even know how many days it's been since the storm. What, 10? I don't know. Let's talk about, I mean, they had some, I saw a picture that they downloaded before you came on of two babies. Talk about that. I mean, that was, look at that.
We had a bunch of NICU babies, which is our neonatal ICU babies. They did say that we could use these pictures because coincidentally, while we had all these little bitty babies, we had to transfer them out. We tried to reach the family members, of course, and the staff did an amazing job trying to get with the parents, because when you are in that particular situation, we need the breast milk, we need the different things to help support the babies. Of course, we can do it. That happened to be a relation to one of our director of food service. That was her sister's babies. So if you get her to talk to you about it, it's a very wonderful story.
Twins?
But it's sad. Is that her sister had the babies. They were, of course, in the neonatal ICU. She's trying to help all of the staff with food services and this and pack them up. And she knows it's her niece and nephew who are getting transferred out. And while she's tearful because she's watching her sister tell them goodbye, she still has to serve everybody that's in the hospital. We still got 120 patients, and we had almost 250 people in there. So she said, but to watch the amazement of our staff and our docs and Dr. Nieves and all the people and Dr. Grant who were there, it's a marvel to watch. But it's still a family member, and it's heart-wrenching, and that's where our commitment comes in, is that we are going to take care of our community.
Right. Construction-wise right now, how much construction is actually going on right now at Terrebonne General Health System?
A lot. We were able, and we were very lucky, is that the people who have taken care of us in the past to do a lot of the work at the hospital immediately recognized that we were injured, and as we reached out, they put us as a priority. Now we're trying to get services up as quickly as possible as far as what we can, because we will have some inpatient. Our inpatient units took the brunt of the issue. So we are standing up those of our most vulnerable populations: cancer, primary care, pulmonary, pediatrics, OB, emergency services. We've got it's only been, this is starting week 2,
Right.
that we are trying to stand those services up and get clinics open as fast as possible so that they can go into the community. You could see our little tent city. You can see we have emergency services, we have COVID tents, and it really looks like a hospital inside to a degree, and people can walk up, drive up, whatever. We're taking ambulances. If we find the situation's bigger than we're able to do, the ambulances are able to send them to a different location. This is our whole emergency department, not all of them, but a large majority of our physicians, our staff. They stood this up in a day. And again, that was the help of the state to get all the tents and things, and it's air conditioned, and they are out there in the 80-something degree heat every single day from 7 a.m. until 5 p.m. We will extend the hours very much so as soon as we got more light. It's a safety issue for staff getting home and our patients coming in. Chabert has a 24-hour emergency room right now. They're on limitations, but we're really trying to be a good community partner between us, trying to stand up as much as we can to take the weight off of them and Thibodeau and that emergency service department.
But, I heard the gloom and doom a week ago, but I started thinking about who was in charge of certain things, and I'm going, they don't know these people like I know these people. And, I don't want to say it's a road bump. It was bigger than a road bump, but I'm seeing the sun peering out now. It's starting to at least show progress, and I know you sort of feel that way too. We got a lot of work left. How can people help watching right now? What are any needs that they could do that would help you?
Well, I will tell you, Martin, it wasn't discouraging. It was a little bit humbling, but my staff's amazing. And the minute we transferred that last patient, we were on how do we open something and how do we do whatever. And our staff, we meet 3 times a day. None of us have gone home. We're going to meet. Some of our staff have been there since way before this, myself included. And we're coming up, and we're going to come up quick. Now, I might not be able to do the services that I had before as quick, but I promise you 24/7 we're going to work for it, and we are. And if people are patient to recognize some of the construction around the building, we'll get you in. We're going to get you in. We are trying to start cancer services for infusions tomorrow already.
Wow.
We are doing COVID testing. We are doing, we're going to start some shots soon. We are being able to offer any of those services that if you're willing to drive up or drive by, we're going to give it to you. We are going to give it to you. We got a radiology and our lab departments up to be able to service some of these. As clinics come up, you got to be able to do testing. So little by little, but it's really been in a short term, we are trying to get up to serve those patients that we're concerned about. So not that we're not concerned about all, I don't infer that, but those that don't really have the element of time that they won't get in trouble. How can people help? I think a consistent understanding of where we are and how we are going to come back. I have a 30-day timetable for some of those ancillary type of things in my mind. That doesn't mean everybody else's, but you know, I'm on go. I'm past go. And we're going to be back stronger than ever. Take us a little more time to get some of those inpatient services back, but we have other ideas. We got other rooms that may not have been as damaged as our core. We are talking to DHH, and we'll use those rooms. So we might have a few less beds, but we're going to be as strong as the services we had before.
Well, I appreciate you coming in and spending some extended time with us. And I know you got a task ahead of you, but I knew you before the hospital, so I know you're very determined, and y'all going to get it done. And, you know, if there's anything the community can do to help, let us know, and we'll try to round it up for you. But thank you so much.
Well, if I could, I want to give a shout out. We've had people offer for food and things, and we designated an area people need to cook on site to help our staff that are out there in the heat or internal. We got 350 people in the hospital today trying to help us. Everybody's cleaning and doing anything that we can. And so, again, doctors, nurses, everyone. So it's amazing. It's amazing.
Yeah, thank you, Phyllis. We appreciate it. Once again, Phyllis Peoples, CEO of Terrebonne General Medical Center. We have Tana McGee coming up. We have a lot of other people coming up, including Senators Cassidy, Senators Kennedy. We'll be right back.